There can be a number of reasons why you may be getting a false pregnancy test. We're going to look at the 5 most common reasons in today's video. Home pregnancy tests work by urinating over the sensor, and it's able to detect a hormone called human chorionic gonadotropin, which is abbreviated as HCG, which is a hormone produced during early pregnancy. Generally, pregnancy tests are quite accurate, however false positive and false negative tests could be possible, so it's important to talk with your doctor if you are planning a pregnancy. The first reason of a false positive pregnancy test can be something known as evaporation lines. Normally, after testing yourself, you normally have to wait around 5 minutes for the results to show up. Lines or symbols tend to show up on pregnancy tests which are non-digital, and sometimes the urine which is present may evaporate and cause a faint line to develop in the area which indicates you are pregnant, which starts to moisten, giving this appearance of a line. It's important to check your results exactly at the time on the instructions, and if you're suspicious of a false pregnancy test, repeat the test again the next day. Certain medications can cause a false positive pregnancy test, and it does this by raising hormone levels in your blood. There are infertility medications and weight loss treatments which contain synthetic HCG, which is the hormone which is detected by a pregnancy test. Therefore, doing a test while taking these medications may give you a false positive pregnancy test. Other medications like aspirin, carbamazepine, methadone can also give a false positive pregnancy test. Certain medical conditions can cause your HCG levels to rise even when not pregnant, so they may cause a false positive pregnancy test. This can be ovarian cysts which produce HCG, kidney disease or certain urinary tract infections, disorders which affect the pituitary gland and alter your hormone levels. It's rare, but there are certain cancers such as breast, ovary, kidney and liver cancer which may also give a false positive pregnancy test. There is a situation which is known as phantom HCG, where antibodies which may be present in your urine bind on the molecules in the pregnancy testing kit. So this interaction makes the testing kit think that HCG levels are high, and it gives a positive pregnancy result, even though HCG levels are low. Another cause of a false positive pregnancy test is if you take a pregnancy test too soon after an abortion or miscarriage. Your HCG levels may still be elevated, although it will be reducing, so this can trigger a positive pregnancy test result. Usually HCG starts to reduce around 5 days after a medical abortion or miscarriage, however levels may still be elevated. Sometimes incomplete miscarriages may occur where tissue from pregnancy is still in the uterus and is producing HCG, therefore surgery may be needed to remove this pregnancy tissue. The final common cause of a false positive pregnancy test, which we're going to talk about today, is a molar pregnancy, and this is a condition where there's a uterine tumour growing. So instead of a normal placenta and embryo, there is an abnormal growth of placenta tissue forming clusters of cells or a mass of sacs which grow. In a molar pregnancy, HCG levels will still increase, causing a positive pregnancy test result. Usually after a positive result, a scan and a blood test is usually booked in with a doctor, so these issues can be detected early on with an ultrasound scan. So we've made it to the end of the video. Leave a 100 emoji so I know you've made it to the end. If you have any questions about anything we've discussed in today's video, write them in the comment section below. Make sure you like, comment and subscribe, and thank you very much for watching.